During the first 3 months of pregnancy, the breasts increase in size, and you'll find that by 16 weeks, your normal bras won't fit. A visit to a local department store or lingerie shop for a maternity bra fitting is recommended.
The midwives recommend that you come out of your underwire bra early on during your pregnancy, which you have done.
That's right.
Basically because the wire sits at the side where your milk ducts are and can actually stop your milk producing. And also the wire lifts up as your bump gets bigger, so it doesn't do the uplifting job that it should do. So we stock a range of bras that have all got no wire at all, but they have got extra support. There's extra fabric at the sides, the straps are slightly thicker. Because what you have to remember is obviously most people go up in the cup size, maybe 1 cup size during their pregnancy, but when you're breastfeeding you will go up another cup size when your milk comes in. On average. Obviously all these bras are maternity and nursing because we think that saves you money. So these are all unclipped for nursing, and on the back they actually have 4 lots of hook and eyes. So as your bump and your rib cage moves up, you can loosen your bra, because if you started off at 36 you will inevitably go to a 38, and that is obviously just your bump increasing in size. But what you don't want to do is buy lots of 38 bras, which are then too big and not supportive enough to breastfeeding. So you can then tighten these bras back up, and also remember to alter your shoulder straps as well, because by altering those you then let a lot more room back into the cup here.
Victoria, a mother of 2, believes that investing in good maternity bras is money well spent.
I wear ones called Bravado. It's quite funky. They do leopard print, and they do plain white, which is this one, and they do all flowery ones, and then different colours. And that's just got, you know, like the pop-up.
Is that really comfortable?
Yeah. The only thing that's a bit irritating is it's got a high back, so it's just a fashion thing. If you're wearing a little top, then you can obviously see the back of it, but if you're not really fussed, then yeah, it's really comfortable, really good support. And really easy to, because you know some of them have really irritating clips that you have to try to, and this is just a little button, which I think is quite good, and they last. I mean, this one is still as good as that one.
What, and this is an old one?
And this is from Theo, so this has done 1.5 years worth of breastfeeding almost, and they're a bit more expensive. I think in Debenhams you could get a nursing bra for £12. These are £27 maybe.
I know some of the high street shops only stock maybe a very plain bras in black and white, and they can look quite granny-ish without, you know, the shaping of an underwire. These are a sort of tactile fabric, and we do sell a lot of this pink just because it's something different and it's pretty. It's sort of one of those times when you really need your pretty underwear on, you really want to feel pretty.
I've got one that's more of a bra, you know, with a back that's got the clips. I got that from Debenhams, but it's just really the clip thing then really digs in. And also the way it works, because this one is just these 2 bits that cross over. When it's down, it's completely down. So from the front you can't really notice, whereas the ones that have the little clip, it seems to have like the shape there and then the little flap over it. So if you're wearing a white top, you can actually see too many different bits of fabric, so it makes your boobs look a bit strange.
For nursing, we recommend to start with maybe to buy a black and a white to put into your hospital bag, and then see how you get on with the breastfeeding. And then if you're obviously planning to carry on for the 6 months to a year, then you will need perhaps 6 or 7 bras. But they're definitely worth investing in, because it's no good being comfortable on the outside in your maternity wear and then having a bra underneath that's too tight. I mean, we do see ladies coming in who've actually got indentations in the skin where they're wearing a bra that's far too tight for them. There is no point measuring you and putting you in a bra that fits you perfectly today, and there is not, you know, an inch of room in there for you to grow. Because with maternity bras you are only going to get bigger. You're not going to be going the other way. And this one in particular actually sits out like this, so that as your bump grows you haven't got anything cutting in to the top. You're not going to have a drawer full of underwear to wear anymore, but you know, 3 or 4 maybe for maternity is enough. Sometimes people even sleep in a bra just because it is more comfortable. I mean, this bra we sell as a sleep bra because there are no hook and eyes on the back, so it's very comfortable to sleep in. And certainly when you're breastfeeding, you're getting up during the night to breastfeed, you will sleep in a bra then to hold your breast pads in place.
A good supporting bra will ensure that you remain comfortable, and it will help to prevent saggy, droopy breasts after the baby is born. Women who've had breast enlargement surgery may feel more discomfort than most, and a well-fitted bra is very important.
It is best to come to a specialist maternity shop. I mean, we have had people that have been into, you know, even the big department stores, and they've been measured, and they sometimes get measured the same way as a non-pregnant lady would get measured. They get measured for a bra that fits them perfectly today, and there is no room to grow. And people come in and sometimes they say, I've got 8 different bra sizes. Well, that's such a waste of money, you know, when you can buy these ones that extend more. We also sell little bra extenders that clip onto the back of these, so that if you do get to the very last hook and you're in the sort of last trimester, you can just add that on, and then you add another inch so that you're not cutting in at all.